Have you ever seen flashes of light, shadow, or cobwebs in your vision? These are what we call eye floaters. As a matter of fact, these are the major symptoms doctors hear every day, and so many people think they are going blind once they experience this. In this video, we'll be talking about three major things you need to know about eye floaters. By the way, my name is Dr. Fee. As you already know, I am always bringing you relevant and accurate eye care tips, helping you know more about your eye health and helping you see your very best today, tomorrow, and in the nearest future. Well, when we talk about eye floaters, they flow naturally across our view or vision. And when you try to focus or get a hold of them, they disappear as soon as possible. Most people do not understand what is going on because eye floaters can be very scary. And that is why people always rush to see their eye doctors because they don't really understand what is going on. Well, in this video, I will point out three major things you need to know about eye floaters and as well the causes, symptoms, and implications, including the treatment options for eye floaters. Remember, they flow naturally in our view or vision as a form of distraction. And when you try to focus to know exactly what is going on, they move away as fast as possible. So you can't get a hold of them or focus to understand what is actually going on. By the way, if you are watching me for the very first time and you would like to learn more about your eye health, kindly click on the subscribe button. You can as well turn on your notification button so you don't miss out on any of our educational videos. Meanwhile, this is Dr. Eye Care Tips. On this channel, you learn a lot about the eye, vision, and eye care tips for the best of eye health. Don't go nowhere. Stay tuned. Well, I don't want you to keep wondering what is going on with your eyes or probably think you might be going blind because of your experiences with eye floaters. And that is the more reason why I am making this video, to make you understand what eye floaters are all about, what causes them, the symptoms, implications, and treatment options available. Most importantly, I want to point out three major things you need to know about eye floaters. So relax your mind. Let's talk about it one after the other so that at the end of the day, you will have a better understanding and a more reason to relax your mind because you are not going blind and nothing serious is actually going on with your eyes. Depending on the severity of your experiences, I am with you. Stay with me. Remember, I said I'm going to point out three major things for us to know or take note about eye floaters. Number one is eye floaters are normal part of aging. They can come as a result of aging, which probably is due to leakage in the eyes from the eye gel, which we call the vitreous humor. This can break down and scatter, then flow randomly in our eyes, causing a lot of distraction in our vision. So when this vitreous humor, that is like a gel in our eyes, break down and scatter all over our eye, they flow randomly, causing a lot of distraction in our vision. And this is what we see as eye floaters. Remember, number one is eye floaters can occur as a result of aging. So it is a normal part of aging. If eye floaters are normal part of aging, that means the higher your age, the higher your chances or possibility or probability of you having eye floaters in your eye. So what is the implication of eye floaters being part of normal aging? In a normal eye, during image formation, light enters the eyes and some part of the eyes help to focus the light on the right spot at the retina where images are formed. But in an eye with eye floaters, these light that are supposed to be focused on the retina are more or less scattered because these eye floaters flow randomly in the eyes. The light that is supposed to be focused on the right spot at the retina is scattered. And the implication of this scattering of light is that at the end of the day, vision will be blurry. So eye floaters can cause blurry vision. And when you talk about the implication or symptoms of eye floaters, you talk about blurry vision. Blurry vision. On the other hand, some certain eye condition can also cause eye floaters. For example, if you are myopic or short-sighted to a degree of about -5 and above, you can have eye floaters, which is as a result of early disintegration or breakdown of the gel, that is the vitreous humors in the eye. This, at the end of the day, will cause eye floaters in anybody having a high degree of myopia or other eye conditions. Do not forget, eye floaters are a normal part of aging. So at one point or the other in your life, you would definitely experience eye floaters. Another thing to take note of, it is not usually a serious concern if it is due to aging, so you can blink as much as you can to get rid of the distraction from eye floaters. So take note and know when eye floaters are distracting you so you don't think too much or think that you are going blind. The second important thing I want us to take note of about eye floaters is the risk of tear or retinal detachment. Like I said earlier, the vitreous humor, which is like a gel in our eyes, has other parts of the eye that are attached to it. Example, the retina. The vitreous humor is attached to the retina, and the breakdown or pulling off of the vitreous, which causes eye floaters, can as well affect the retina. If the retina breaks down, it is an ocular emergency, and this is what we call retinal detachment, which is majorly as a result of the peeling off or the breakdown of the vitreous humor in our eye, which causes eye floaters. So take note of retinal detachment in eye floaters. Even though retinal detachment as a result of eye floaters or vitreous breakdown is an ocular emergency, there is no warning sign. People only notice a flash of light in their vision, and this is as a result of the breakdown or the detachment of the retina, in which the brain sees as a physiological excitation of the retina and responds to it as a flash of light. So you always notice a flash of light, like a light burst. So if you're having any of these kind of symptoms like blurry vision or a random flash of light in your vision, this is the right time to see your eye doctor for immediate intervention. The earlier this is detected and taken care of, the better for you. So you don't need to wait. Make that smart move. Report to the nearest eye clinic in your location for proper assessment, diagnosis, and treatment. Another implication of eye floaters as a result of vitreous humor breakdown is that it affects the macula. The macula is part of the retina that is involved majorly in image formation. This is the part of the retina where images are formed. So when you have eye floaters, some of the particles that break down or some part of the vitreous humor that has broken down can affect the macula, in the sense that some may drop at the macular site, blocking the macula or forming a black spot or hole on the macula. So when images are formed, they are more or less blurry, and this can affect your daily activities, your driving, your reading, or anything at all that has to do with your vision. So this is another implication of eye floaters, one of other ways it can affect your vision. So if you have any of these symptoms, report to your eye doctor. The third thing I want us to take note of about eye floaters is the treatment option available when we talk about eye floaters and the experiences so far. So the other issues I mentioned like retinal detachment and the ocular or macular hole which affect our vision, they can be treated separately. But going directly to eye floaters, if they are not significant enough, if they are just a little, it is not a serious concern, and you can always take care of the eye floaters by blinking multiple times, and your brain can also adapt to it if they are small in size. But on the other hand, if the eye floaters are of a serious concern, if they are large enough, and especially if they are flowing randomly in the central part of the retina or the macular area where vision takes place or where images are formed, it will be a serious concern and it has to be taken care of for it not to affect your daily activities, especially the activities that you like so much. So, in this case, we have two treatment options. Talking about the treatment options available for eye floaters treatment, we have number one, we have what we call vitrectomy. This is the surgical removal of the gel in the eye. This is one of the oldest treatment option, but unfortunately, it is not commonly used or recommended by eye doctors because of its high level of complication. It has a high level or high probability of complication. But if the eye floaters is of a serious concern and it is affecting your vision, it can be considered so you can have the best of vision at the end of the day. So the second treatment option is laser surgery, laser eye surgery. This will specifically take out the eye floaters inside your eyes as they are flowing randomly, especially if they are not large. This laser surgery will specifically take them out. So depending on the severity of your experience with eye floaters, you can consider any of the two options. You can as well visit your eye doctor, talk to your eye doctor, consider the two options so you know the one that is best for you depending on the severity of your experience with eye floaters. So before we come to the end of this video, let's go to the eye health question of the day. Have you had any of these experiences or you know anyone that has experienced one of these symptoms we are talking about, or anyone that has eye floaters? What did the person do? Or if you're the one that has experienced it or you're experiencing it already, what are you doing about it? What have you learned about eye floaters from our video? Let us know your experience in the comment section. Don't forget, this is Dr. Eye Care Tips. We are always bringing you relevant and accurate eye care tips, helping you know more about your eye health and helping you see your very best today, tomorrow, and in the nearest future. Don't forget, eye care is for today, eye care is for tomorrow. It is for me, it is for you, it is for everyone. So, if you are watching me for the very first time and you would like to learn more about eye health, kindly click on the subscribers button. You can as well turn on your notification button so you don't miss out on any of our educational videos.